Hello, I'm Dr. Robert Peterson, geriatric specialist. Today we'll explore why loss of leg strength in seniors often stems not from just getting old, but from deficiencies in three key micronutrients. I'll briefly review the underlying biochemistry, then show you how targeted, food-based strategies can reverse weakness and prevent painful cramps. By the end, you'll have clear, clinically grounded steps to nourish your nerves and muscles. No expensive pills required. Vitamin B12 and neuromuscular integrity. Vitamin B12, or cobalamin, is indispensable for maintaining the myelin sheath that insulates peripheral nerves. This fatty layer allows rapid saltatory conduction. Action potentials jump from node to node, reaching muscle end plates in milliseconds. In seniors, however, age-related atrophic gastritis reduces intrinsic factor secretion, impairing ileal B12 absorption. Biochemical role: cobalamin is a cofactor for methionine synthase, regenerating methionine from homocysteine. Methionine is required for methylation of myelin basic protein. Deficiency elevates methylmalonic acid, MMA, which itself may be neurotoxic, promoting distal axonopathy. Clinical presentation. Early, subjective leg shaking, difficulty rising from chairs, unsteady gait. Neurological exam, decreased vibration position sense at ankles, slowed deep tendon reflexes, Achilles, Romberg positive at Y. Subclinical demyelination can persist despite normal serum B12. MMA is a more sensitive marker. Pathophysiology timeline. Weeks of inadequate intake, thinning of myelin, conduction velocity declines by up to 30%. Nerve signal latency increases. Functional tasks like the timed up and go, tug, test worsen by 20 to 40%. Case deep dive, Mrs. Evelyn baseline, tug 18 seconds. Age predicted, E12S. Serum B12, 260 pg by ml, low normal. MMA 0.8 umol/L, elevated. Intervention: daily 1 boiled egg plus 1/2 cup plain yogurt, 1.5 ug B12, plus fortified nutritional yeast, 1 TBSP, = 2.4 ug, twice weekly. Monitoring: repeat tug and proprioception testing at 4-week intervals. MMA normalized, 0.3 umol/L by week 6. Tug improved to 11 SAS. Patient-reported steadiness rose from 210 to 810. Dietary strategies. Spread B12 sources across meals. Animal proteins, eggs, yogurt, lean poultry. Fortified cereals or yeast for vegetarians. Consider sublingual B12 if severe malabsorption is confirmed, e.g., pernicious anemia. Vitamin D and skeletal muscle function. Vitamin D's myotropic effects go beyond calcium homeostasis. Its active form, 1025-dihydroxyvitamin D, binds vitamin D receptors, VDRs, on myocytes, modulating gene transcription for contractile proteins and preserving type 2 fast-twitch fibers critical for power generation. Cutaneous synthesis versus dietary intake. Aging reduces 7-dehydrocholesterol in skin by 75% by age 70. Sunscreen use and indoor lifestyles further limit ultraviolet B, UVB-driven cholecalciferol formation. Molecular mechanisms. Enhances expression of calcium-binding proteins, e.g. calbindin in myocytes, improving excitation-contraction coupling. Attenuates inflammatory cytokine production, IL-6, TNFA, in muscle interstitium, reducing catabolic signaling. Epidemiological evidence. Prospective cohorts show seniors with serum 25 OHD, 25 ng/ml, have 45% higher risk of falls and 30% greater decline in gait speed over 5 years. Controlled trials. Supplementation raising levels to 30,000 ml yields, 15% increase in quadriceps strength, and 25% faster sit-to-stand performance. Case deep dive. Mr. Michael baseline, 25 OHD 16 ml. Unable to complete 5 times sit to stand 5x in under 20 seconds. Frequent nocturnal cramps. Intervention. Daily 15-minute morning sun exposure, arms, face. Dietary. 2-3 oz servings of salmon weekly. 800 IU total vitamin D. Supplement. 800 IU daily vegan-friendly D3 when fish intake low. Outcomes at 8 weeks. 25 OHD x 34 ml. 5x improved from 22 s to 15 s. Cramps resolved completely. Implementation tips. Prioritize sun exposure before 10 a.m. to minimize skin cancer risk. Incorporate fortified plant milks, 100 IU per cup, and eggs, 40 IU each, into breakfast. Monitor calcium intake. Target total dietary calcium 1,000 to 1,200 millidomines daily to support bone metabolism. Magnesium and excitation contraction coupling. Magnesium serves as a cofactor for ATP synthase, Na+, K+, ATPase, and SERCA pumps, and it regulates calcium release from the sarcoplasmic reticulum. Deficiency disrupts calcium homeostasis, causing involuntary prolonged muscle fiber depolarization, manifesting as painful cramps and impaired relaxation. Cellular physiology. Mg2+ stabilizes ATP in the form of MAG-ATP. Without it, cross-bridge cycling efficiency drops. It competes with Ca2+ for ryanodine receptor binding, preventing excessive Ca2+ leak that triggers spasms. Clinical markers: serum Mg, often normal despite deficiency. Erythrocyte Mg, or 24-HRH urinary excretion, better reflect stores. Symptoms: nocturnal calf or foot cramps, residual stiffness, tachycardia, irritability, and occasional arrhythmias. Case deep dive, Mrs. Fern. Presentation: nightly calf cramps waking her 3-4x per night. ESS, Epworth Sleepiness Scale, is 12-24. Labs: serum, Mg 1.8 mg/dl, lower normal. Erythrocyte, Mg low. Intervention: daily 1 oz pumpkin seeds, 150 mg. Spinach salad, 1 cup cooked, 156 mg at dinner. Pre-bed snack, half banana, 32 mg. Outcome at 2 weeks, cramp episodes. 80%, ESS equals 624, subjective sleep quality, much improved. Dietary guidance. Distribute Mg intake across meals to maximize absorption, peak, or 100-150 milligrams per serving. Emphasize whole grains, quinoa, brown rice, legumes, black beans, nuts, almonds, and leafy greens. Advise limiting high-dose zinc supplements, which can competitively inhibit Mg uptake. In summary, leg weakness and cramps in seniors often reflect reversible micronutrient shortfalls rather than inevitable aging. By ensuring adequate vitamin B12, vitamin D, and magnesium through simple, whole food strategies and brief daily sun exposure, you can re-establish neuromuscular health and regain confidence with every step. I invite you to implement these changes tomorrow morning. Add a protein-rich breakfast, spend a few minutes outdoors, and include a magnesium-rich snack before bed. Your legs and your independence will thank you.